So many of us in the field actually understand why parents have a lot of questions about medication, and why there can be some skepticism about the diagnosis of ADHD and the main treatment of ADHD, which is medication. Regarding the skepticism about ADHD as a diagnosis, we think one of the origins of this skepticism is that there actually is a fair amount of overdiagnosis of ADHD when it's not diagnosed appropriately. In fact, one of the more common ways to get a diagnosis of ADHD is to go through a brief evaluation with a physician or other clinician who asks the parents some questions, may or may not meet the child, and may or may not meet or talk to the child's teachers or other adults in the child's life. We feel that ADHD is a valid diagnosis and can be accurately diagnosed in kids, including preschoolers, if it is done in a very thorough way. The guidelines really specify what you need to do a good evaluation, including talking to teachers or other educators in the child's life and getting information about their behaviors in multiple settings. Also, it's important to get information about the developmental course of ADHD. So if you have an evaluation where the clinician is not asking questions about when these symptoms first occurred, you're not likely to get a good, accurate diagnosis. So we'd recommend that parents who are dubious about ADHD as a diagnosis, but they're concerned nevertheless about their child's behavior, go to a specialist who's going to take the time to gather information from multiple different sources over time and spend a good deal of time with you and your child to make that diagnosis. Regarding the skepticism about medication, it's also understandable, as some may have the impression that a quick diagnosis often leads to a quick recommendation of medication. And what we would recommend for parents is, because we actually know a lot about ADHD and about how medications affect children, to actually ask many questions about the information we do have. This is actually a diagnosis that was among the first to be identified in children, and in terms of medications, it's among the first to actually be prescribed for a child mental health problem. And there's a lot of research on it, dating back decades, in terms of the main effects and long-term effects of this medication. So there's a lot of information to be gained by asking qualified professionals about the sorts of things that they have found in their research. All right? And one of the greatest studies to really look at are those published over the past few years that give longitudinal, that is long-term information about side effects and long-term effects on growth, on development, on things like substance use, etc. Above all, it's important that the family feels comfortable with the clinician they're working with. In fact, comfortable to ask difficult questions. If you're asking the sorts of questions that indicate that you're skeptical about treatment, and the person you're talking to doesn't also have a healthy amount of skepticism, and doesn't refer to actual research to answer those questions, then you're right to feel uncomfortable. Whoever you're working with should have some questions and should have some skepticism about what everybody seems to be saying or everybody seems to be doing, and when they're giving you their opinions, those opinions should be backed by scientific fact. That's important. That's actually something I tell parents. They come and they're almost apologetic about asking me the sorts of questions that they have, and I say, no, ask all of them. Ask even the most awkward and embarrassing questions. If I can't answer those, then you shouldn't be comfortable working with me.